For articulation, voicing means the vocal folds are adducted, and voiceless means the vocal folds are abducted. There are two different things that happen with voicing in consonants. For sonorant consonants like nasals, the tap, liquids, and glides, there's phonation during the consonant due to unobstructed airflow and a lack of any voice in contrast in English for these sounds. For the obstruent consonants, the stops, the fricatives, and the affricates, there is phonation at the edges of the consonants at least. For fricatives, phonation may cease due to buildup of air pressure behind the constriction, but phonation may continue throughout the fricative. For the stops, phonation usually ceases as airflow is interrupted by the stop closure. Voicing for voiced stops and fricatives will resume soon after that constriction is released. Because it's difficult for there to be voicing through obstruents, there are often alternative cues to voicing in obstruents, and English takes advantage of some of these cues. For consonants before a vowel, there is the presence of aspiration, or a duration known as voice onset time, the delay until voicing starts after the consonant. That is a cue for voicing. For post-vocalic consonants, there is variation in vowel length before the consonant. For intervocalic consonants, there is variation in consonant duration. These differences are schematized in the image at the bottom. For initial consonants, voiced consonants will have a shorter voice onset time, a lack of aspiration. Voiceless consonants will have a longer voice onset time with aspiration present. For final consonants, vowel duration will be longer before the consonant for voiced consonants and shorter before the consonant for voiceless consonants. For medial consonants, voiced consonants will be shorter in general, so closure duration for stops or the duration of fricatives. Voiceless stops and fricatives will have a longer duration. The second dimension of contrast for consonants is place of articulation. Looking at the active articulators that we have for English speech sounds, there are three groups of consonants. The labial consonants, where the lips are an active articulator, the lingual consonants, where the tongue is an active articulator, and the laryngeal consonants, where the vocal folds are the active articulator. For labial consonants, we have lip articulations like lip closure for P and B, as well as for the nasal M. For the labial glide, the W, there's lip rounding and protrusion in addition to the tongue articulation. And for our labiodental sounds, we have the lower lip touching the upper teeth for F and V. We have a large number of lingual consonants in English. In the interdental consonants, th and the tongue is placed between the teeth or behind the upper teeth if the person produces the dental variant of this sound. For the alveolar sounds, the tongue tip contacts the alveolar ridge or gets close to it. Depending on the particular sound, other articulations may be involved. So for t and d, there is a closure where the tongue tip makes a seal at the alveolar ridge. For s and z, the fricatives, there's a narrowing at the alveolar ridge. For the n sound, the nasal, closure is present just like for the stop, but the velopharyngeal port is open. For the l sound, the tongue tip contacts the alveolar ridge, but additional articulation is done by the tongue body to allow lateral airflow. For the tap sound, the articulation is much like the stop. It's just a very quick ballistic articulation. For the palatal sounds, tongue blade approaches or makes contact with the hard palate. For sh and zh, there is a narrow constriction between the tongue blade and the hard palate. For ch and j, there is a closure at that location followed by a narrow constriction like a fricative. In the case of r, the tongue makes some sort of constriction in the region of the palate, but the constriction is not very narrow. And similarly for something like y, the glide, there is some narrowing in the region of the hard palate, but not a significant constriction that would create frication noise, for example. There are no velar fricatives, so the velar stops and the nasal all have closure between the tongue dorsum and the hard or soft palate. In the case of the nasal, the velopharyngeal port will be open. The image on the right shows some variation in articulation for the tongue body depending on the context. So, for example, before a front vowel like in ki, the tongue will be in the forward position indicated by the black lines. Before a back vowel like in cool, the tongue will be in the rear position as indicated by blue. The laryngeal consonants involve articulation within the larynx using the vocal folds. The glottal stop is an interruption of airflow by tight vocal fold adduction. This is not an independent phoneme in English, but is found as an allophone in a variety of situations. In some dialects of English, this is found as an allophone of T. So, for example, in Cockney English in the United Kingdom, they would say something like button. It's found as an allophone of T in some contexts in American English. So, for example, a minimal pair like C liner versus seat liner has a glottal stop in place of the T consonant to indicate the presence of the T there in that co-articulatory context before an L. The glottal stop can also be used to indicate a juncture in sequences of vowels or resonance. So again, a minimal pair like steady awning versus steady yawning, where there is a basically identical articulation in steady yawning from the E to the Y at the beginning of yawning, has continuous airflow. So to contrast that, in the case of steady awning, the glottal stop is used to indicate the onset of awning. The laryngeal fricative has a narrow vocal fold constriction that produces turbulent noise. When producing the fricative, the tongue body position varies. It's usually in place for the following vowel, and so there's quite a bit of variation in the acoustics of the H sound.